You know that feeling maybe first thing in the morning, that stiff back, or maybe sudden sharp pain when you bend over?
Oh yeah, happens to a lot of people.
Well, you're definitely not alone. Today, we're getting straight into facet joint injuries. They sound small, but these little hinges in your spine can, well, they can cause some real trouble.
They really can. Back pain is just so incredibly common, isn't it?
Yeah.
And yeah, these facet joints, often they're right at the heart of it.
Mm-hmm.
We've got some great revision notes here. And the plan is really to boil it down, give you the essentials on what happens when these joints act up.
Right. No need to wade through really dense medical books. We're pulling out the key info so you can actually understand what might be going on, maybe even in your own back.
Exactly.
Think of this as like your clear guide to facet joint injuries, what they are, why they happen, how doctors figure them out, and crucially, what you can do about them.
So first things first, what are these facet joints?
Good question.
Okay, picture tiny little bony knuckles on the back of each bone, each vertebra in your spine. They basically link the vertebrae together, allow you to bend, twist, lean, but they also keep things stable.
So movement and stability.
Precisely. And a facet joint injury. It's simply damage to one or more of these joints.
And what causes that damage? Is it usually one thing?
Not always. It can be sudden trauma, a fall or an accident, but it can also be gradual wear and tear, just life, really, or repetitive strain.
Okay, so trauma, wear and tear, strain. What about risk factors, things that make it more likely?
Yeah, we can group those. Think about those sudden, forceful movements we mentioned. Degeneration, like osteoarthritis, is a big one.
Right.
Poor posture definitely doesn't help. Lifting heavy things, especially the wrong way. High-impact sports put a lot of stress there, too.
Makes sense.
And previous spine issues can make you more prone. Even things like obesity, carrying extra weight, or jobs that involve prolonged loading on the spine.
That's quite a list. Any easy way to remember the main risks? Like a mnemonic.
Well, you could think about it like maybe sudden movements, posture problems, osteoarthritis, repeated strain, and trauma.
Sport. Maybe.
Sport. Okay,
Yeah.
that could work. So when one of these injuries happens, what's actually going on inside the joint?
You might get a sprain, which affects the ligaments holding the joint together,
Right.
or a strain in the muscles nearby trying to compensate.
Mm-hmm.
Sometimes, though less common, you can actually get a small fracture in the joint bone itself.
Ouch.
Yeah. But the main point is, the joint's normal structure and how it moves gets disrupted, and that triggers the body's response. Pain and inflammation.
Okay, and how does that usually feel? What are the telltale signs someone might have this?
The classic sign is localized pain, right over the injured joint in the back or neck.
Pretty specific then.
Often, yes. And a key thing, it often gets worse when you extend your spine, like leaning backwards, or when you twist.
Ah, okay, like reaching for something high up. Exactly that kind of motion.
Yeah.
You might also feel stiffness, find it hard to move normally, get muscle spasms around the area. Sometimes the pain even refers, like down into the buttocks or up to the shoulders.
So if someone has those symptoms, how do you know for sure it's the facet joints? There must be other things it could be, right?
Absolutely. That's where differential diagnosis comes in. We need to rule out other possibilities.
Like what?
Well, simple muscle strains, other ligament injuries, maybe a slip disc, spinal stenosis where the spinal canal narrows. Lots of things can mimic it, so proper diagnosis is really key.
And how do you get to that diagnosis? What investigations are involved?
It always starts with the basics. A good physical exam, talking through the patient's medical history and symptoms.
Right.
Then imaging can help. X-rays are good for looking at the bones, checking for degeneration or fractures.
Okay.
If we need more detail on soft tissues like ligaments or nerves, an MRI or maybe a CT scan is usually next.
And I've heard about injections.
Yes, diagnostic facet joint injections, or blocks. That's where a doctor injects numbing medicine right into the suspect joint under guidance.
Ah, so if the pain goes away?
Bingo. It strongly suggests that joint is the source of the pain. It's a really useful diagnostic tool.
Got it. So let's say it is confirmed. What's the management plan look like?
The goals are pretty clear. Relieve the pain, get function back, and promote healing.
Makes sense.
Usually we start conservative. That means things like relative rest, not complete bed rest, but avoiding aggravating activities. Physical therapy is huge here.
For strengthening and flexibility?
Exactly. Strengthening the muscles that support the spine, improving flexibility. Pain medications like anti-inflammatories can help manage symptoms too.
What if that's not enough?
Then we might consider spinal injections, often with corticosteroids, to reduce inflammation and pain more directly in the joint.
And surgery, is that common?
Much less common. It's usually reserved for really persistent, severe cases where other treatments haven't worked. Things like spinal fusion might be considered, but it's definitely not the first step. The approach is always tailored, Depends on the person, the severity, all that.
Right. And what's the general outlook, the prognosis, and are there potential complications?
Generally, the prognosis is pretty good, especially if it's caught and managed appropriately early on. Most people get significant relief and get back to normal activities.
That's encouraging.
It is. But complications can happen. Some people might develop chronic pain or ongoing limited mobility. Muscle weakness can occur if it affects nerves. And unfortunately, these injuries can sometimes recur. It might also potentially lead to other spine issues later on. Early intervention really helps improve the odds.
Okay, so let's just quickly recap the absolute key takeaways.
Sure. Facet joints. Think spinal movement and stability. Injury means localized pain, stiffness, often worse bending back or twisting.
Diagnosis involves exams, maybe imaging like X-ray or MRI, and sometimes those diagnostic injections.
Right. And management.
Yeah.
Starts conservative rest,
Yeah.
PT, meds. Injections are an option. Surgery is rare.
And the outlook is generally good with treatment.
Exactly. Early action is best.
Fantastic summary. Really clear. And look, if you want to cement this knowledge or explore other medical topics for revision, definitely check out passmsra.com.
And SRA.com as well, both excellent resources.
Absolutely. Well, thanks for taking this deep dive into facet joint injuries with us today. The big takeaway, listen to your body.
Definitely. Don't just ignore persistent pain. Understanding what might be going on is that crucial first step.